when I would say first that Surgeon Generals typically are the champions of politically unpopular but yet scientifically valid endeavors, things that benefit the people, and that's one of the jobs that we do all the time. Because each of us recognize that no matter what administration nominates us, our job is not to be the physician, the doctor of the Republican or the Democratic Party. Our job is to be the doctor of the people and address the needs of the people, which is distinctly different than political issues that arise during an administration. So it's a very tough position because of that. When I came into office in 2002, 2010 was already in place, and I used that as a roadmap, but not exclusively, because there were areas that weren't covered, that weren't anticipated. For instance, national preparedness was not something that was on everybody's radar screen in the late 90s when people were thinking about an early part of the new millennium, thinking about war and some of the challenges we had with anthrax and such. But I think it was a very, very good document, one that provided a roadmap for me. But as I looked at the challenges in my portfolio, number one had to be prevention, for reasons that we all know. That mounting disease burden, economic burden, all of which, or most of which, was preventable. Preparedness issue, health disparities. From a personal point, I felt it was a valid thing to pursue, but clearly the literature was on my side, that we were a nation divided. The paradox for me was that what makes us so strong, the diversity of this nation, also divides us and gives us lots of problems. And it's expressed in health as well as economics and what we now know as the social determinants of health. So that was something I spent my time in. As I looked at the 2010 People document as a roadmap, one of the things I realized also was that I needed a currency to be able to translate a lot of that to the people, to effect behavioral change. And that's where health literacy came in. As Joyce's already said, all of us recognize that we're largely a health illiterate nation. Even very intelligent people don't get the connection between their behaviors and their ultimate health outcomes. So focusing on health literacy, using that as a platform to address prevention, preparedness, health disparities. And of course, I recognize in office, one of the things that was not in the 2010 report was the importance of global health. We are all inextricably interconnected. The dots globally are all connected. A little child who dies in sub-Saharan Africa in AIDS has a rippling effect on this world, economically, socially, and medically and scientifically. So recognizing that as a nation we have a very powerful tool that often remains unleveraged in science and technology, to be able to project that globally, to attempt not only to bring health to places that desperately need it in a humane way, but health also helps to eradicate some of the divisiveness that exists in the world. If you project it humanely, you can eliminate asymmetries of health, of wealth, ideology, theology, and in doing so can avert possibly some of the challenges that we get into that lead to war and divisiveness. So health is a powerful tool that we need to leverage much more. And as Surgeon General, all of us are privileged to be able to use health, not only for the benefit of health itself, but because of the tangential benefits it brings to a very unstable world. Thank you.